stenosis. What is spinal stenosis? Now, as working moms, we are usually sitting at our desk for long hours and mostly without a frequent break in between that long sitting hours. Now, it can cause back pain. Now, this back pain can be just due to the mechanical stresses of sitting for that long, or it could be any other reasons like disc issues or stenosis, etc. Now, if your doctor has, you've been to your doctor and your doctor has told you that you have spinal stenosis, it can sometimes be an overwhelming diagnosis, and it might be possible that you're wondering what exactly is stenosis. So let's do a very simplified version of what exactly is spinal stenosis. Now, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs manage their spinal, that is their back and neck pain and joint pain, basically all the aches and pains that develop during your motherhood journey, ranging from your pregnancy to childbirth to the earlier toddler years. Now, as working moms, we are busy people, right? So we don't have a chunk of time to take out to manage our aches and pains. And this is where I come in. I help you with simple strategies, easy lifestyle changes, and some easy exercises that you can incorporate into your existing daily schedule. And yeah, so let's go back to the topic for today, which is spinal stenosis. So, what is spinal stenosis? Now, spinal stenosis is a general term. It can be of, it is basically divided into like two parts. So it can be central, that is at the level, at the central level in your spinal cord, in and around your spinal cord, or it can be, it can be it can be on the sides of your spinal cord, that is known as a foraminal stenosis. Now, before I explain these terms that sound really complicated, let's go a little bit into the anatomy of the spine, because then you can better understand what exactly is a stenosis. Now, when you look at your spine, there are vertebrae stacked or one on top of the other with the disc in between. You've got the joints on the sides of the vertebra as well. So that is your general overview of the anatomy of your spine. Now, sometimes it happens that there is a narrowing. Basically, stenosis is a medical term for narrowing. So sometimes it happens that there is a narrowing centrally where your spinal cord is passing through in between your vertebrae. So, okay, let's look at this in more details. So if you look at a vertebra, so this is somebody standing, this is their spinal cord. But if you are looking like at a vertebra face down, if you look on, like you're looking at a vertebra, you'll see that there is like a big hole, or this area where the spinal cord passes through. So if you stack these vertebrae one on top of the other, there is like a big area for your spinal cord to pass through, right from your, the base of your brain here down to your lower lumbar spine, like more towards the sacrum or the tailbone area. So this is where your spinal cord is passing. Now, if there is a narrowing in this central canal in between your vertebrae, that is formed by the vertebrae rather, if there is a narrowing in this area due to any reason, we'll come to the reasons after this. If there is a narrowing there, it is possible that there is an irritation or compression or some sort of a pressure on your spinal cord. When that happens, it is known as a central stenosis. Sometimes people will loosely use the term spinal stenosis to describe central stenosis as well. So, if your doctor tells you you have a stenosis, you can go and ask them what level is the stenosis? Is it central? Is it more towards the side of the vertebrae? So, you can ask these questions to know more about it. Or if you look at your MRI reports or your scan reports or your x ray reports, and if there's any mention of stenosis, you can look at it and see if it's a central or peripheral or foraminal, if these terms have been used. So let's come to this foraminal stenosis now. Now, when you look at your vertebra, there are joints on the sides of the vertebrae. Now, these joints are known as the facet joints. If you have seen any other videos of mine describing the disc issues or degeneration of the spine, I have addressed these in more detail. So if you want to know more about the facet joints and how they can be affected, you or their anatomy, you can go to my YouTube channel and just type back pain or spinal pain, and you will come up with these videos. So going back to what I was saying, when you have these facet joints on the side at every level in your in your spine, there are nerves exiting these facet joints as well. Now, the nerves are exiting through a hole, so basically a foramen. So, foramen is again a medical term for a hole. So, there is a hole on the side formed by these joints, and that's where your nerves are coming out from. So, for example, the nerves that are exiting the foramen on either side of the spine in your neck will supply your shoulder area and down the arm and forearm right up to your fingertips. The one from your lower back will go down from your bottom down into your legs and to the tips of your toes, right? So these are what the normal anatomy is. Now, if for any reason there is a narrowing on the side of of the spine, that is in this foraminal area, in this hole, now that is known as a foraminal stenosis. So basically it is a stenosis or a narrowing that's happening on the side of your spine. So it can be left or right or both. Okay, so depending on what exactly is the reason. So this is what is foraminal stenosis. So next time your doctor uses this terminology, or when you're discussing your case or your medical history with anybody, and they use these terminologies like stenosis or central stenosis or spinal stenosis or foraminal stenosis, you know what exactly they're referring to. Now, there can be multiple reasons for this stenosis, which I'm going to address in my next video in details. However, to give you a brief idea, it could be anything ranging from your degenerative disc diseases, that is basically issues with your disc, arthritis, osteoarthritis, or any bony spurs that form because of arthritis. So those are like extra bony growths that can go and impinge or block away these holes or these spaces through which your spinal cord, your nerves are passing. Or it could be an injury, you've had a fracture or a trauma to your spine, and then there is like the bone segment has moved, which is causing the narrowing. Or it could be tumors, or it could be an infection, there's swelling in the area. So it could be a multiple reasons why you can get stenosis. Now, sorry, I'm going to, as I said, I'm going to address these in details in my next video. So I'll tell you briefly what these conditions are and how they can cause stenosis. Now, if you are looking for more information on how to manage your spinal pain, that is your neck or back pain, I address this issue these spinal pains and how to manage them in my free community. I will leave a link in the description of this video. If you're watching me on Instagram, the link is in my bio. You just click on it and you can join. It is a free community, and this is where I do trainings every month, and these videos also go on there. So the training for this month of April, if you're watching this in real time, will be on how to manage your back pain. So if you have any back issues, then you can join my free community and you can access the free training. It is you have lifelong access to it once you join the community, and it's all free. All right, so I hope to see you guys next time, and if you have any questions, any comments for me, please drop them in below this video and I'll pick it up from there and I'll address them there. Alrighty, I'll see you guys next time. Bye for now.